Good morning, I'm Dr. Moalemi from Amelia Heart and Vascular Center, and today I'm going to talk to you about atrial fibrillation. This is going to be a series of talks, and atrial fibrillation in and of itself is a complicated topic, so we will be giving you very short synapses about atrial fibrillation and its different parts. So if you want to continue learning about atrial fibrillation, you're going to have to see our other videos. But today I'm just going to describe to you what atrial fibrillation is. Atrial fibrillation is an irregular rhythm of the heart. In order for you to understand what that means, I need to teach you a little bit about what an EKG. So when we do an EKG, we take an electrical picture of your heart. So the heart has 4 chambers, and these chambers are connected to each other via structures called valves. The electrical system of the heart is embedded in the heart. Any other muscle in your body is controlled by your brain. You want to move your hand, you command it from your brain, neurochemicals get to your hand, and you basically move your hand and you know that you moved it. But your heart is constantly beating and you're not aware of its beating because electricity is embedded inside the heart. It starts in an area called the sinus node, and the sinus node is made of a conglomerate of cells that exchange ions, sodium and potassium and chloride, in such a ratio as to create a microampere of electricity. That electrical wiring works from cell to cell until it reaches to the middle of the heart, an area called the AV node. And the AV node propagates this impulse or this electrical activity across the 2 chambers of the heart in the bottom. And then once that electrical activity gets to the entire heart, calcium gets released into the muscles of the cells, the muscles, and those cells contract, and you get a contraction of the heart. When the electricity starts in the sinus node on the EKG, you see a little blip called the P wave. When it gets to the middle of the heart, you get something called the QRS complex. Then the heart contracts in the ST segment, and then it relaxes in what's called the T wave, and then the process starts all over again. This rhythm is called a normal sinus rhythm. It's normal, it comes from the sinus, and it propagates exactly how it should. Normal sinus rhythm is a heart rate between 60 to 99 beats per minute. If you are running, you're anxious, you have fever, you're sick, and you need a faster heart rate, everything happens, but exactly the same way, except faster. And what you'll see is on the EKG, you have a faster rhythm, but you have the P wave, the QRS, and the T wave. This is called sinus tachycardia. And sinus tachycardia is a rhythm that starts from the sinus rhythm, but is faster than or equal to 100 beats per minute. When you are sleeping and relaxing and you don't need a fast heart rate, the same thing happens, but it's much slower. So now you get sinus bradycardia. And every one of these rhythms is a completely normal rhythm. If you get very anxious and you go to the doctor and they do an EKG and they see that your heart is just a little faster, they might tell you that you're anxious, and that's why it's normal. But it turns out there are centers in the top chamber of the heart and the bottom chamber of the heart that can become active and can send impulses into the middle of the heart when you don't need them to do so. There are areas in the top left atrium where the pulmonary veins drain into the heart, where cells can become really active and bombard the AV node with multiple impulses that want to conduct. Now, the AV node cannot go that fast, and so it will conduct as much as it wants to. And so on the EKG, you will see a lot of P waves, because remember, P waves are coming from the top chamber of the heart, and then QRSs that are not equidistant. So you will see something like this all over the map. This condition is called atrial fibrillation. So that's all for today. I just wanted you to know what atrial fibrillation really is on an EKG and how we detect atrial fibrillation when you go to the doctor and get an EKG done.